always watching their dollars and cents when it comes to spending money on animals. And we thought, hey, if we can get a unit that will help us with chronic arthritis and pain management in dogs without having to sedate them, that would be ideal. I never dreamed 5 years ago when we got the machine, and it still works as good today as it did then, that we would be using it as often as we do and seeing the improvement that we continue to see with it. One of the things that's a big difference between this machine versus a machine that we are going to use a sedation with is that we're getting the biofeedback. And so I feel like we have to do a couple of house cleaning things before we actually go into canine cruciate disease. Biofeedback from the Wave, I feel like, is one of the gems of this machine. I'm looking at my patient and I'm watching his behavioral cues to let me know that I'm at the right level on creating a response within his tissues. But doing that, we're seeing the positive and seeing the feedback from him as well as getting him to improve. But I'm not a techie person, and so being able to have a machine that's pretty much maintenance free was another reason we chose to go with this model. I don't have to do much upkeep to have it running for me, and there's nothing worse than going to choose a modality to help one of your patients to find out you have to get it in and service it before you can use it, and it's always in the shop versus on the patient. So again, that equates to us using it more. We use it probably 20 to 30 times a day, every day, and we have for 5 years, so it's pretty crazy. Our biggest complaint on this machine, none. We have no complaint. We have no complaint from clients. We have no complaints from our technicians. And actually, my technicians will administer most of the treatments once we explain it to the clients. So very user-friendly. So canine cruciate disease, this is kind of the big can of worms in veterinary medicine when you're in rehab. You know, a lot of people will walk in our doors here requesting that we treat their dog for canine cruciate disease without going to surgery. And so that makes it very important to us to kind of dot our I's and cross our T's and make certain we are selecting the right patients for that. So when we're selecting a patient for rehab only for canine cruciate disease, they have to meet a number of requirements. One, it has to be that the owner financially cannot afford surgery, or two, that the patient cannot safely undergo surgery. So at this point in time, surgery is still the gold standard treatment for managing canine cruciate disease. Now that we've gotten through that, we're going to tell you the fun part of managing canine cruciate disease, and that's with Shockwave. So we manage partial or complete tears. We manage based on diagnosis, basically. So is it a partial tear? Is it a complete tear? Do we have a fusion in the stifle? Is our range of motion affected? Do we have a lameness with the leg? Do we have pain on extension? One of the big things you're going to hear over and over again tonight is, do we have concurrent meniscal damage? And is the dog painful? So these are all parameters that we're looking for before we start treatment with these guys. My physical exam collection is the same as yours. So I'm going to do my complete physical exam. I'm going to assess for my positive cranial tibial thrust. I'm going to assess for drawer and flexion as well as extension. I'm going to take my lateral flexed radiograph of the stifle joint. Just because I can, I'm going to do digital thermography on the joint because I think it's cool to collect information. I'm going to do goniometric measurements of the stifle joint as well as thigh circumference too. And then I'm going to do my stance and my gait analysis because I want to have objective tools that tell me if my patient's improving. And I'm going to recollect all of this information every 4 weeks to keep me honest as a rehabilitation practitioner and to show my clients where their dog is improving or where their dog is static. So another thing to consider with this is it chronic versus acute? And your chronic dogs, you're going to have your prominent medial buttress. This has been my demo dog for a while, so he is adducting his leg as tight as he can. But I'd be feeling for if he has a palpable medial buttress on the inside of his stifle and crepitus and flexion and extension. And if I'm not feeling those, then that tells me, hey, it may not be as in chronic in nature. Maybe it was more partial tears that's led up to a final complete tear with him. So when we decided way back when to try Shockwave on canine cruciate disease, it was basically taking the disease itself and breaking it down into what is cruciate disease. We know it's multifactorial. We know we have loss of integrity of the ligament, so I have my little model to remind us. But we have loss of integrity of the canine cruciate ligament Is it the complete fibro destruction or is it a partial tear? We don't know from the outside source, so we wouldn't know without looking. But we know that we will have inflammation in the joint. We'll know that we'll have degenerative joint changes. We know that we're utilizing fibrocartilage as far as our medial buttress to help to stabilize these legs when they're healing on their own versus surgical. So Shockwave, and why would we would think that would be a fair treatment option when doing rehab with a dog? Shockwave helps to improve cartilage health. It helps to improve range of motion on the joint. It improves weight bearing and helps to improve vascularity and healing to tendons. And then we were proposing that it would help to heal ligaments too. Obviously, it's not going to sew back together a completely destroyed ligament, but our partial tears. Shockwave, obviously, you guys know, works through acoustic sound waves generated via pressure pulses. Shockwave also is analgesic, and most of our patients feel better, similar to them having a non-steroidal response to treatment for their osteoarthritis. Cruciate disease causes effusion in the joint, and I think that's something that we overlook in general practice. But the effusion makes these dogs really painful and really limits their extension, and Shockwave helps to mobilize the effusion and get it out of the joint as well, so it helps with comfort. So administering Shockwave allows for neovascularization, so increased blood flow, increased tensile strength of the ligaments and tendons, stromal cell health and differentiation to allow for the promotion of new bone growth, stem cell migration and stimulation of all the big guys, PCNA, eNOS, VGF, reduction of levels of TNF alpha and interleukin 10 to levels found in normal joints from the arthritic joints, thus aiding in osteoarthritis management. Shockwave also decreases leukocyte infiltration and suppresses local inflammatory responses. So we know our effusion is primarily white blood cells, and we know with these guys the effusion is part of the degenerative joint disease. Shockwave also results in neovascularization of ligaments and tendons. So now when we go in and we use needle arthroscopy with these guys and we look at the joint and what's going on, we actually see the neovascularization happening in the ligaments, which is telling us, yeah, it's actually doing what it says it's going to do. So our proposal when we started this 5 years ago, when we're adding this with the medical management of cruciate disease, was would it help to alleviate pain and improve function? And honestly, we thought we would improve pain or decrease pain and improve function about 10 to 12% of the time. That was our hypothesis or a theory at that point in time. We were extremely surprised that we see it increase function about 80% of the time. Actually, some of our results have gone up as 88.9% of the time improvement in function. Does it lead to normal stifle support? No. Does it lead to cranial drawer resolvement? No. Does it lead to stifle effusion resolvement? Yes, every time the effusion goes away. Does stifle extension improve? Yes, every time. And we're going to go over some numbers too. And does medial buttress stabilization occur? This was the weird one for us. No. So at normal medical management, normal rehabilitation of canine cruciate disease, no matter what treatment modality you're doing, we get a nice big medial knob, and we don't get that with Shockwave. So we're protecting the extension with these guys, thus minimizing the occurrence of the second knee blowing. Does Shockwave change or improve the stance analysis and gait analysis on these dogs? Yes, and always for the better. Does function improve? Yes, unless, and we're going to get to the unlesses in a little bit. And does Shockwave improve pain control better than with NSAIDs or with rehabilitation alone? Yes, 100%. So unless there is a meniscal tear. So we live in an area of the U.S. that kind of demands that we think outside the box when it comes to rehabilitation of most of our canine athletes. Obviously, this guy's not an athlete, he's just a house pet. But with our canine athletes in the area, all of our agility clubs and our flyball dogs and whatnot, we have a kind of a bigger job to do because all of these people, and I'm certain you guys are seeing them too, want their dog to perform, but they don't want to spend the money on them. And so when they come in, most of our clients that come in cannot afford the surgery just because of the cost of doing the surgery. And so we wanted to be able to see with these guys, hey, is this a valid treatment option to add, and can we get these dogs back to performance animals? That was one of the big questions. Yeah, we're setting them up for arthritis later on. We're destroying the dog. No, that's not what we found. We found that a lot of these dogs go back into performance, and it all has to deal with the client, patient, and veterinarian relationship. So it's kind of the triad of seeing a successful rehabilitation patient. Most of the patients that we have worked on, that we started when we started our study, were patients that were here versus euthanasia. So the clients had no money, or the dog had chronic disease, and they were here to see if we can make a difference with their dog, or they were going to euthanize the dog because they just couldn't handle spending that kind of money on stabilizing the joint. So in the thinking outside the box world that we live in, of course I tried laser therapy. Now we refer to it as photobiomodulation. Of course I tried acupuncture. Of course we tried e-stim. Of course we tried rehabilitation alone. We didn't see the same effects with these dogs as we do by adding in the Shockwave. So I think probably the biggest take-home message of tonight is know your patients and pick them well when you're treating them with Shockwave. You have to have compliant owners. If the owners are non-compliant, they are not a Shockwave candidate. Just stick with straightforward rehab with those owners. The ideal patients cannot have the ability to take their pet to surgery, or surgery is not an option because of underlying disease. I still feel like that we have to maintain the gold standard as surgery to protect ourselves in the profession and to protect our surgeons out there doing what they're supposed to do, which is to stabilize the knee.